Hey everyone, this is Ansari. I'm a recent MPH graduate with epidemiology as my major. This poster presentation is about systematic reviews and meta-analysis of use of prophylactic antibiotics prior to dental procedures in adults with joint prosthesis. This project was done by Brad Bemis, Bertman Bradford, and myself. So let's start with a bit of background. Prosthetic joint infections are one of the serious complications after total joint arthroplasty. The infection could spread from a distant anatomical site such as oral cavity, heart or lungs to the prosthetic joint. One-third of these PJIs are heterogeneous in nature. Patients with prosthetic joints are thought to be at a higher risk of infection after a dental procedure and are prescribed antibiotics to prevent it. Whether the antibiotics help in preventing the PJIs is a topic of dispute. Prescribing the antibiotics as prophylaxis is more out of the comfort on the prescriber's part and is not based on any evidence. There is no compelling evidence in potential benefit or harm of the antibiotic prophylaxis in reducing the PJIs. Hence, this systematic review and meta-analysis. Hence, in this we attempt to determine if prophylactic antibiotics prior to dental procedures reduces the prosthetic joint infections in adult patients with prosthetic joints. This was conducted in accordance with preferred reporting items for systematic review and meta-analysis, that is PRISMA statement for the year 2009. PubMed, Scopus, and Sinhil databases were searched for relevant articles. The eligibility criteria included all adult patients, all gender, any prosthetic joints, and those who underwent dental procedures with prophylactic antibiotics. Comparison group had same eligibility criteria except no antibiotic prophylaxis. The outcomes included were relative risk, hazard ratios, or odds ratio for the joint infections. Randomized control trials, retrospective or prospective cohort studies, and case control studies were included. Quality assessment was performed using Robbins 1 tool to evaluate bias, as well as grade tool to assess inconsistency, indirectness, imprecision, and publication bias, in addition or overall risk of bias. Meta-analysis was performed on studies that provided the specified exposure and outcome variable. Meta-analysis with random effects model for binary outcomes with calculation of a pooled OR was done. Heterogeneity was determined using Cochrane chi-square statistics and I-square statistics. A funnel plot was created to evaluate the publication bias. A flow diagram of such results is shown here in figure 1. 1,852 articles were initially screened, and full text for 105 articles was reviewed. A total of 11 articles were used in the study. Only 2 articles were included in the meta-analysis, as they were the only studies that included antibiotic prophylaxis as exposure of interest. The forest plot of the meta-analysis is shown in figure 2. The pooled OR is 0.99, indicating no change in odds with antibiotic prophylaxis. Chi-squared statistics was 0.07, indicating no heterogeneity. However, given there were only 2 studies, I-square was 0 and heterogeneity could not be fully evaluated. Funnel plot for the publication bias is shown in figure 3. It is limited given the small number of studies, but neither risk nor benefit is favored overall based on the plot. The quality of the study was low, with majority being retrospective single center observational studies. Robin 1 bias assessment of 11 articles revealed moderate to serious bias, primarily from confounding. The grade assessments of studies revealed low quality of evidence, given that they were non-randomized. Based on this study, we can conclude that there is lack of high quality literature on this topic. There are no randomized controlled trials that evaluate the efficacy of prophylactic antibiotics prior to dental procedures. And based on these study results, we can also say that there is no change in the odds of prosthetic joint infections with antibiotic prophylaxis. And there is no evidence that antibiotic prophylaxis reduces the risk of PJIs with antibiotic prophylaxis in adult patients with prosthetic joints. Thank you.